Thank you for joining us today and welcome to the California Budget Report 2022-2023. My name is Linda Mendoza and I'm the chair for the Legislative Committee. Today's report will be presented by the following committee member, Karen Gregorius. Our first slide that we have here is the state's Health and Human Services 2022-2023 funding. As the majority, as you can see, it goes to Medi-Cal and also the developmental services on the side up to underneath the state hospitals in the 1991 and 2011 state local realignment. Here's our overview. We're going to be going over the following topics: health, including mental and dental, aging, IHSS, SSI, SSP, children's education, childcare, developmental services, including DDS, Assembly Committee, and Senate Committee. I would like to start it off with VMRC Special Assistant to the Executive Director, Doug.
Thank you, Linda. So we're going to start in healthcare and health plan equity and quality standards. So the administration proposed an investment for the Department of Managed Healthcare in collaboration with other entities to establish a priority set of standard quality measures for full service and behavioral health plans, including quality and health equity benchmark standards, and to take enforcement actions against non-compliant health plans. Improving equity through managed care plan reprocurements. As Medi-Cal and Covered California managed care plan contracts come up for renewal, the administration will work to include a focus on health disparities and cultural and language competency through health plan contractual language with a framework similar to the Blueprint equity metric. Analysis of COVID-19 impacts. The budget includes 1.7 million general fund last year and 154,000 general fund this year going forward for the California Health and Human Services Agency to conduct an analysis of the intersection of COVID-19 health disparities and health equity to help inform any future response. And then community navigators, the budget includes 5.3 million for the Department of Developmental Services to contract with Family Resource Centers to implement a navigator model statewide. Next slide is Medi-Cal coverage to all income eligible Californians. So 835.6 million in 2023-24 and 2.6 billion annually thereafter, inclusive of in-home supportive services costs to expand full scope eligibility to include all eligible adults aged 26 through 49, regardless of immigration status. And beginning no later than January 1, 2024, Medi-Cal will be able to be available to all income eligible Californians. And then the IHSS permanent backup provider system, that's 34.4 million ongoing to establish a permanent backup provider system for IHSS recipients to avoid disruptions to caregiving due to an immediate need or an emergency, and to provide a $2 wage differential for backup providers. The Department of Healthcare Services, their Medi-Cal, which is California's Medicaid program, is administered by DHCS, the Department of Healthcare Services. Medi-Cal is a public healthcare program that provides comprehensive healthcare services at no or low cost for low-income individuals. The federal government mandates that a range of basic services be included in the program, and the state provides additional optional benefits. The department also oversees county-operated community mental health and substance use disorder programs, CCS, the California Children's Services, and the primary and rural health programs. The 2022-2023 budget for Medi-Cal is $123.8 billion, and the governor's budget assumes that caseload will increase by approximately 8.3% from 21 to 22 and decrease by 3% from 22 to 23. Medi-Cal is projected to cover approximately 14.2 million Californians in 2022-2023, which is over 1/3 of the state's population. Next, we have CalAIM. CalAIM stands for California Advancing and Innovating Medi-Cal. CalAIM is a framework that encompasses a broad-based delivery system, program, and payment reform across the Medi-Cal program. CalAIM recognizes the opportunity to move the whole person care approach that integrates healthcare and other social determinants of health to a statewide level, with a clear focus on improving health and reducing health disparities and inequities, including improving and expanding behavioral health care. So updates to the department's Section 1115 CalAIM demonstration, along with related contractual and Medi-Cal state plan changes, will enable California to execute the CalAIM initiative, providing benefits to certain high-need, hard-to-reach populations with the objective of improving health outcomes for Medi-Cal beneficiaries and other low-income individuals in the state. So the budget includes $1.2 billion last year and $2.8 billion this year, with another $2.4 billion next year, and followed by $1.6 billion 2024-25 for CalAIM. And the initiatives being implemented in 2022-2023 this year include mandatory enrollment into managed care of beneficiaries eligible for both Medi-Cal and Medicare. The requirement that all managed care plans cover long-term care, the provision of a targeted set of Medicaid services to eligible justice-involved populations prior to release, and the providing access and transforming health, the acronym is PATH initiative, to further the successful implementation of CalAIM. Incarcerated individuals leaving correctional facilities are at high risk of poor outcomes due to high rates of mental illness, substance use disorders, other complex medical conditions, and potential social needs such as housing, insecurity, unemployment, and inadequate social connections. So CalAIM proposes to improve outcomes for this population by managing a county pre-release Medi-Cal application process for incarcerated individuals, allowing Medi-Cal reimbursement for services in the 90-day time period prior to release, and to encourage facilitated referral and linkage, like a warm handoff to behavioral health services, both to providers and managed care networks, and to county behavioral health departments. The next CalAIM is PATH. So PATH includes the following programs and initiatives: justice-involved startup funds to build on the successful work conducted under whole person care pilots. This PATH program will build statewide capacity and expand access to necessary pre-release and post-release services under CalAIM. Support for implementation of enhanced care management and community supports, including whole person care services and transition to managed care. Technical assistance, collaborative planning, and capacity and infrastructure transition, expansion, and development funding for providers, community-based organizations, and counties. An additional goal of CalAIM is to develop a new foster care model of care. This will address the complex medical and behavioral health needs of foster youth. And to build on the continuum of care reforms, the administration intends to work with stakeholders in the budget year to develop a new model of care. Department of Healthcare Services and the Department of Social Services will center this effort on establishing an accountability framework across systems, advancing equity, and integrating services and care. Next is Medi-Cal eligibility redetermination. So the budget includes $73 million each last year and this year for counties to resume annual redeterminations of Medi-Cal beneficiaries. Next is reduction of Medi-Cal premiums. So to increase access to healthcare services, the administration added to reduce the financial burden of paying for healthcare coverage for approximately 500,000 Medi-Cal enrollees who pay monthly premiums for coverage. So in this budget, $53 million annually to reduce premiums for beneficiaries, including pregnant women, children, and disabled working adults whose income is marginally above the threshold for the no-cost Medi-Cal. And you can see more details in the early childhood chapter. The next one is behavioral health needs of California's most vulnerable. So the administration's vision is to transform the behavioral health system, resulted in significant investments last year in the Budget Act that support generational change to reimagine the children and youth behavioral health system, investments in facilities, investments in Medi-Cal to increase timely access to care using a no wrong door approach, whereby a beneficiary can enroll in Medi-Cal in a number of different places for mental health and substance use disorder services. So this year, Cal Health and Human Services will develop a plan to support connections between prevention efforts like hotlines and peer support services, the 988 mental health crisis call centers, and mobile crisis response at the local level. The budget includes $7.5 million for the California's Governor's Office of Emergency Services to advance implementation of the 988 call system and support call handling equipment so the existing crisis hotline centers have the needed resources to process additional 988 calls and coordinate and transfer calls with no loss of information between the 988 calls and the 911 system. More details of that are in emergency response. And then in addition, the budget includes $1.5 billion over 2 years for additional housing supports to those with behavioral health needs, as well as $1.7 billion in care economy workforce investments, which includes funding to recruit and train 25,000 new community health workers, as well as additional psychiatric providers. The budget also includes $10 million to administer a competitive grant program to prevent and treat depression as part of the California Initiative to Advance Precision Medicine. Next one is the felony incompetent to stand trial waitlist solutions. So like many states, California is home to thousands of vulnerable and ill individuals who, as a result of limited community-based and early intervention treatment, decompensate to a point where engagement and treatment is difficult. Many of these Californians with the most severe behavioral health conditions become fixed in a cycle of untreated mental illness, homelessness, and incarceration. Criminal defendants who are unable to understand the criminal proceedings or assist counsel in their defense are determined by a court to be incompetent to stand trial. If charged with a felony, they can be committed to the Department of State Hospitals to provide clinical and medical services with the goal of restoring their competency and enabling them to return to court to resume their criminal proceedings. Although this budget proposal and recent prior budget acts make significant investments that will build up behavioral health infrastructure in communities, the current lack of community behavioral health services has led to a rapidly growing number of people who go through the IST and get referred to the DHS, the Department of State Hospitals. In June of 2021, an appellate court affirmed the order in Stiavetti versus Clendenin, requiring DHS to commence substantive competency restoration services for all ISTs committed to DSH within 28 days of receipt of the commitment packet from the court. Court orders and penalties regarding ISTs could cost California as much as $1 billion. Let's see, 115 in this new budget, 115 annually based on the state of Washington's experience, despite increasing bed capacity, decreasing the average length of stay, and implementing county-based treatment programs. The increasing number of county IST referrals has resulted in a large wait list and long wait times for defendants pending placement to DSH. Furthermore, the impacts of COVID-19 pandemic and necessary infection control measures put in place in DSH facilities resulted in slower admissions and reduced capacity for treatment of felony ISTs at DSH. In the fall of 2021, DSH convened an IST work group to identify actionable solutions to address this increasing number of individuals with serious mental illness who are deemed IST on felony charges. Informed by the deliberations of the work group, the budget reflects spending of $93 million in 21-22 and $570 million in 22-23 ongoing. These funds are going to provide for a few things. First is early stabilization and community care coordination to provide immediate solutions to support access to treatment for nearly 1,700 individuals currently found IST on felony charges and waiting in jail, and to reduce the flow of new incoming referrals. This includes funding for early access to medication stabilization teams to encourage substantive treatment in jail settings, statewide funding for medication support, and DSH case management teams to coordinate the IST care with counties and other community providers. Also expanding diversion and community-based restoration capacity to increase IST treatment alternatives by investing in the community infrastructure required to support the felony IST population. And this is going to include funding for infrastructure to increase the number of residential beds in the community that are dedicated to the DSH diversion and community-based restoration programs, augmented funding for counties to expand DSH diversion and community-based restoration, support county partnerships for entities impacted by felony IST community placements, and workforce development support for counties and community providers. These investments support the goal of providing care in the least restrictive community-based settings while maintaining public safety. In order to encourage the expansion of community care that does not create unintended incentives that drive additional IST referrals, the state will implement a growth cap on IST referrals that will include a county cost sharing methodology if the growth cap is exceeded. The ability of the state to address the IST waitlist is directly impacted by the Lanterman-Petrus short conservatorship census at DSH facilities exceeding current contracted levels with counties and LPS patients being held longer than their treatment plan requires. Welfare Institutions Code Section 4147, which established the IST Solutions Work Group, provides that if insufficient progress is made in addressing the wait list, Cal Health and Human Services may discontinue the admission of new LPS patients, establish LPS reduction targets for counties, and charge counties that do not achieve reductions 150% of the current bed rate for LPS patients. The coordinated behavioral health investments made as part of the 2021 Budget Act, and the budget will support county efforts to serve individuals at risk of becoming IST upstream before they become involved in the criminal justice system, including investments to the behavioral health continuum, infrastructure program, and the proposed $1.5 billion general fund over 2 years in housing options for those with behavioral health conditions. Next, we have mobile crisis services, Medi-Cal and community-based mobile crisis services. So the American Rescue Plan Act of 2021 authorizes 85% federal matching funds for a Medicaid mobile crisis response services benefit available for 12 quarters during a 5-year period starting April 1 of this last year of 2022. DHCS will add multidisciplinary mobile response services for crisis related to mental health and substance use disorders as a new Medi-Cal benefit as soon as January 1 of 2023. Providing community-based mobile crisis services will help reduce the impact of untreated behavioral health conditions on emergency departments and psychiatric facilities by providing a system for triaging and referring people to services in the community. Over the 5-year period authorized by the Act, total costs of this new benefit are projected to be $1.4 billion. This benefit builds on the $205 million and other funds last year's Budget Act provided to counties for infrastructure development in preparation for the implementation of the mobile crisis benefit. Next, we have ACEs, which are adverse childhood experiences, and specifically an extension of adverse childhood experiences provider training. So this budget includes $135 million over a 3-year period to extend Medi-Cal provider training for ACE screenings. And the last section I have is dental care. So the administration has proposed to extend dental managed care contracts and reprocure new contracts no sooner than January 1, 2024. That is all I have for my sections. I'm going to turn it over to Karen Gregorius to present next.
Thank you, Doug. I'm Karen Gregorius. I'm the class member representative for the Legislative Committee. All right, I'll be talking about aging as the first topic. By 2030, the population of California's over age 60 is projected to be greater than under 18 for the first time ever. And record numbers of people will be living to age 100. This shift in California's population is changing family life, communities, and the economy with new opportunities and challenges. To support California's aging population, beginning in 2021 Budget Act, the state made a substantial investment in response to the governor's master plan for aging and Alzheimer's task force recommendations to prepare for more Californians living longer and to advance inclusive, equitable communities for all ages and abilities. To further the administration's goals, this budget includes additional investments to support the state's aging population, which includes reforming nursing facility financing. Currently, the state provides an annual cost-based increases in quality incentive payments to skilled nursing facilities, which are funded partly by a quality assurance fee equivalent to 6% of the facility's revenues. The resulting revenue draws down additional federal funding to support facility payments. The existing framework was authorized initially in 2004 and last extended in 2020. It sunsets on December 31st, 2022. The budget proposes to reform the funding framework to move from a primarily cost-based methodology to one that incentivizes value and quality. The intent of the reform is to further enable nursing facilities to invest in quality and patient care while assuring the long-term financial viability of these essential medical providers. The budget also includes an expansion of the Alzheimer's Healthy Brain Initiative. It includes $10 million in one-time general fund to continue support for the existing Alzheimer's Healthy Brain Initiative, which guarantees in 6 local health jurisdictions and expands up to 6 additional local health jurisdictions to support activities consistent with the U.S. Centers for Disease Control and Prevention of Alzheimer's Association Healthy Brain Initiative, state and local public health partnerships. The 2018 to 2023 roadmap is a public-private partnership to promote brain health and better care for people living with cognitive impairment, increase attention to caregivers, and build public health capacity. Right. In addition, the budget also makes a range of targeted investments to propel age, disability, and dementia-friendly communities statewide. This includes the Master Plan for Aging. The budget includes $2.1 million, which is $1.8 million general fund, to bolster the Master Plan for Aging's data dashboard and to drive outcomes and sustain public engagement for statewide initiatives throughout the Department of Aging, and strengthen civic engagement policies and programs in the California Commission on Aging. It also includes enhanced healthcare access for the working disabled population. $1.5 million in general fund will go to ongoing reduce Medi-Cal premiums for working adults with disabilities and to continue progress on California's goal to expand access to healthcare and increase the affordability of home care. In addition, the budget includes monies for volunteering and community engagement. It includes funding for various volunteer programs across the state, including a one-time $10 million general fund program to engage older adults in volunteer service. It also includes inclusive and equitable employment monies, $7.6 million for an expanded California Leads as an Employer initiative throughout the California Department of Human Resources to continuously recruit and support a state workforce that reflects all of California, which includes renewed efforts to employ Californians with disabilities. The budget also includes funding to protect and empower at-risk and aging disabled populations. California is increasing investments in serving the growing number of older and disabled adults with more complex needs across the range of specialized services. The budget includes $10.6 million in general fund annually for 3 years to continue the Return Home Well program to provide transitional housing to parolees at risk of housing insecurity or homelessness. Approximately 25% of the parolee population is 50 years or older. A new position to best coordinate with public health conservator agencies serving people with probate conservatorships at the California Department of Aging will be created. The new position will be focused on supporting aging individuals with developmental disabilities and their families at the California Department of Developmental Services. Hi. Moving on, Doug touched on it a little bit, but we're going to continue to discuss a little more about in-home support services. In-home support services, the IHSS program provides domestic and related services such as housework, meal preparation, and personal care services to eligible low-income individuals with disabilities, including children, adults, and seniors. These services are provided to assist individuals to remain safely in their homes and prevent more costly institutionalization. The budget includes $18.5 billion, which is $6.5 billion of general fund for IHSS programs in 2022-2023. An average monthly caseload in this program is estimated to be 599,000 recipients in 2022-2023. Due to the $15 per hour state minimum wage effective January 1st of 2022, the governor's budget includes $192 million in general fund to address this. IHSS is a permanent backup provider system. The budget includes $24.8 million for ongoing to establish a permanent backup provider system for IHSS recipients to avoid disruptions to care due to immediate need or emergencies. Right. And lastly, I will cover supplemental security income, SSI, and state supplementary payments. The federal SSI program provides a monthly cash benefit to individuals with disabilities, including children, adults, and seniors who meet the program's income and resource requirements. In California, the SSI payment is augmented with an SSP grant. These cash grants help recipients meet their basic needs and living expenses. The Federal Social Security Administration administers the SSI and SSP program, making eligibility determinations, computing grants, and issuing combined monthly checks to recipients. The state-only cash assistance program for immigrants provides monthly cash benefits to the aged, blind, and disabled individuals who are ineligible for SSI and SSP due solely to their immigration status. This budget includes $3.1 billion in general fund for the SSI SSP program. The average monthly caseload in this program is estimated to be 1.1 million recipients in 2022-2023. a 5.9% federal SSI cost of living adjustment and a 24% SSP increase took effect on January 1st, 2022, bringing the maximum SSI SSP grant levels to $1,040 per month for individuals and $1,766 per month for couples. The budget assumes an additional SSP increase of 24% effective January 1st, 2024, resulting in an estimated $296 million general fund increase in 2023 to 2024 and $593 million ongoing. That would fully restore SSP monthly payments for both individuals and couples to pre-Great Recession levels. This increase is projected to bring maximum SSP grant levels to $1,123 per individuals and $1,940 per month for couples in 2024. That concludes my portion of the presentation. I'd like to turn it over to Linda Mendoza, Committee Chair and VMRC Vice President.
I'll be talking today about children's services. First, you have former foster youth tax credit. The budget proposes a refundable $1,000 tax credit for the young adults ages 18 through 25 who are former foster youth at age 13 or older. Second is the Foster Youth Independence Pilot Program. The budget includes $1 million one-time general fund available over 2 years for county child welfare agencies to provide case management and support services for former foster youth utilizing federal housing choice vouchers in the Foster Youth Independent Pilot Program. The third is the Family Finding and Engagement. The budget includes a $1,750,000 general fund ongoing for the department to provide additional technical assistance and training to counties in meeting the need for children in foster care and unaccompanied minors to be connected to permanent families. The fourth is the Resource Family Approval, also known as RFA, applications. The budget includes $6.1 million, $4.4 million general fund, one time available over 3 years for county child welfare agencies to address resource family approval applications that have pending or probationary approval for more than 90 days. And last is the Helpline for California Parents and Youth. The budget includes a $4.7 million one-time general fund available over 3 years to continue operation of a helpline for parents and youth. The helpline is a statewide continued operation of a helpline for parents and youth. The helpline is a statewide triage and support system establishing during the COVID-19 pandemic that helps deliver services to children, families, and caregivers by phone and online. Next is a special education. First is the child care. The budget continues to support historic investments in child care and development programs included in the 2021 Budget Act. Child care and nutrition programs were transferred from the Department of Education to DSS, effective July 1st, 2021. The administration will continue to build on key recommendations from the Master Plan for Early Learning and Care to transform state's child care system. Other significant adjustments, the California Food Assistance Program, CFAP expansion. The budget includes a $35.2 million general fund for planning purposes, increasing to $113.4 million general fund annually in 2025 and 2026 to expand the SFPA to Californians aged 55 and older, regardless of immigration status, based on statute included with the 2021 Budget Act. The food bank resources is the budget includes a $50 million one-time general fund for the Cal Food program to migrate increases in food needs along low-income and food insecure populations throughout the state. Pass-through of child support collections for formerly assisted families under the current law. Families formerly receiving a state assistance, such as CalWorks, do not receive the full pass-through of child support payments collected by the state, but the budget would waive the state's share of recoupment, resulting in a total estimated pass-through to formerly assisted families of $187 million annually. Now I'd like to turn it over to VMRC's Executive Director, Tony Anderson.
Thank you, Linda. Thank you, everybody. And this is how it is these days with, we have a very big committee, a very robust committee, very busy. And yet with COVID and things going on, we've missed some of our members, but I'll be our last speaker today. Today, I'm going to focus on all of the different changes in developmental services. So there's a lot of things going on here. There's some really exciting initiatives and different ways of looking at the developmental services budget. So I'm going to try to look at it in different angles. So the first slide here shows the DDS budget, a slide from the department, and just showing the proportion of spending from last year and then this year as well. What you'll see here is growth, pretty tremendous growth in the budget, and what you also may not notice is that there's in the 2021-22 budget year, we saw a pretty severe decline in the eligibility and in the early start, and then the regular case management, the Lanterman Act services, a very slight increase. So, which did not keep up with the trend of growth. So, given that, the state is still projecting a very high growth and expecting to rebound from that. So that's why you're seeing the increase here in the chart. In the next slide, this is another slide from the department and another way of looking at it. So this is the several of the new policies that came forward in the budget year. And so if you look at the first one, children's support and early start coordination, $65.5 million. So a lot of effort in this area. Reduced caseload ratios for children through age 5. So 0 to 5, it was a priority the governor put forward to have children 0 to 5 on smaller caseloads. So that did in fact happen. And so there'll be, the ratios will be 1 to 40. So a lot of effort will go into place to hire service coordinators to serve these smaller caseloads for this age set. Resources to increase preschool inclusion of children's services by the regional centers. Efforts there throughout the budget. You'll see a lot of different proposals that the government has to link back with education and with childcare. Have regional centers do more work in these areas. IDEA technical support for service coordinators, and this is a brand new position in all of the regional centers, and it is a pretty high level position inside regional centers. We'll be looking for people who got their teaching credentials, years of experience in education and experience with working with children with disabilities. So it's a new position, and you'll be hearing about it throughout the year, but a major commitment here to help regional centers and schools coordinate better in the education of children with developmental disabilities. And then throughout, there'll be, obviously with infrastructure changes, you'll need additional funds to the Department of Developmental Services, and monitoring will be throughout the budget. You'll see it throughout, and there's some additional funding here to assure that all the new funds that are going to the new programs are doing what they're supposed to do. Communication assessments for consumers who are deaf. It's another a new budget program, a budget item, $15 million, and to help so that we can get assessments, communication assessments for all children or all folks who are deaf, and it would be reflective in their IPPs, so that we would know that it happened, and it would be we would know what their needs are. Sub minimum wage phase out pilot. This is this item here. It says new service model, you'll see, and then the other one is at the headquarters workload associated with this. This is the proposal, or not the proposal, but this is the change in law that makes it no longer a viable option to pay somebody with a developmental disability sub minimum wage, less than the required minimum wage for work. So in order to achieve that, there'll be some need for additional special programs, and this is some funding for that, as well as some oversight and making sure that the funding is used in this for this reason, and to see and to watch the numbers improve. And then finally, federal compliance screening activities for regional center providers, screening and background checks, DDS headquarters to make sure that that has been occurring as well. And I'll move on to my next slide. There's a lot here. Like I said, it's a very large and progressive budget that hits on several of the issues that have been long time desires and requests and meeting long time needs. So this one here is new policies in the final budget, promoting workforce stability. A lot of money in the budget this time on focusing on the direct support professionals. So in the first line item here, they add up to 186 million. A one-time spending. So training stipends for workers, providing direct support services. So the emphasis on training the workers and the new workers that are coming in, $127.8 million there, entry-level training and internships for direct support professionals, service coordinator tuition reimbursements. So looking at inside the regional centers as they expand and meet these ratios. And then also, what do we do to retain workers in the regional centers? So there's a stipend program there for tuition reimbursement. And then the pilot remote sports. This one just says we'll be looking at different ways to provide some remote services in different settings. And this still needs to be developed, but there are some funds here for what that might look like. And we'll be working with stakeholders and people with disabilities to determine what are those kinds of services that might best be provided remotely. So we'll learn more as that goes on, but there's significant funds in that area as well. Service access and equity grant program, 11.8 is basically doubling and one-time funds, doubling the money towards addressing the disparity issues that have been identified in the state, and actually accessing, improving the access to the services for all people with developmental disabilities throughout the community. So some significant funds in there that are new funds. And then financial management services listed here, $7.2 million. And this is what we're going to do is take out the cost of financial management services from the consumer's budget, the person's budget, and then we'll pay for it outside of that. The regional center will pay for that outside of the person's budget, so they would have more funds available for the services, the other services that they receive. So there's also a lot of other things that are happening to try to address the concerns that the FMS, the financial management services providers, have identified as barriers to the system and providing services. So a lot happening in that space. And so excited to see a commitment of funds there, and then also the attention to addressing the barriers that they have identified. Early start eligibility. I've got 6.5 million here, and very exciting changes here. They've made a couple of changes to how we'll determine eligibility. I'll hit that later, but we'll be expecting more children coming into our system because of the changes that we're making in determining eligibility. And then this half-day billing elimination is something that has been happening on and off for some time, and now it will be permanently eliminated. And many of the providers have expressed over the years that this has been a financial burden to them. So this will be helpful for them as well. In the next slide, just kind of trying to give you an overview of all these different things that are happening. I hit on some already, the FMS I mentioned, the early start eligibility, the changes that are in the budget that are going to help us bring in more children with into the early start program. So we're going to change the communication area, and we're going to look at their receptive abilities and communication separately from expressive. So we'll look at each one separately, and then we'll also be changing the threshold of delay. So typically we've been looking at 33% delay in a variety of different areas, and now we'll be looking at 25%. And also fetal alcohol syndrome is specifically mentioned as a qualifying it's established risk condition. So not that it's a qualifying condition, but it is something to be considered when determining eligibility. Tailored day services listed here is it's been an existing model, so there'll be some changes, some significant changes made here. So tailored day services now will be allowed, or now are allowed with other services. Prior, it was only you could only do a tailored day or something else. So you can do it now in conjunction with something else. That will be helpful. The flexibility, the tailored day services would have some flexibility and could be provided by remote electronic communications as well. And then instead of tailored day services being capped at 80% of the cost of a typical day program, the proposal would limit the rates not to exceed a vendor's current daily or hourly rate. So it was done originally as a cost savings. And so that's why it had to be, it forced that service to be less than. And so now that has been removed to make it more viable for the provider community. So that is really helpful, because the other big thing that's going on in here, probably not even listed in those, is that the alternative non-residential services are proposed to end by the end of the calendar year. So by December 31st, 2022, alternative services model is set to end. So there's a big reliance and hope that the tailored day services will be an option that will help replace the need for the alternative non-residential services. So more to come on that in that area, but those are programs in the budget. The next one I wanted to highlight here is some Hcbs piece, some component here in Hcbs home and community-based services section having to do with regulations and rulemaking. The DDS will have authority to adopt regulations to bring the state into compliance with home and community-based services and issue directives until the regulatory process is officially complete. So it gives them an ability to fast track that process, which is going to be needed. And then another big exciting new thing is a thing called Coordinated Family Support Services. And these services would be defined as respectful of language, culture, and ethnicity, and can focus on life planning and end-of-life planning for consumers living with aging caregivers, really looking at a way to support somebody living at home with their family throughout their lifetime. And so some changes that would have to be made to create this new service, and it'll be set up, I think, as a pilot first, and it will move on from there. If successful, we'll learn from that and see how that works for families. And then the next part is complex needs data, and each institution for mental disease, these are called IMDs, is what they're normally referred to. It's always hard to say that because it's not the type of language we would normally use, but that is a technical term for that service. So these IMDs, anyone that admits someone served by a regional center would quarterly report this to the regional center and to the department. So the information is currently reported only to the client's rights advocate. So expanding the information on to the regional centers and the department. And then statewide limitation on the number of enhanced behavioral support homes using delayed egress and secure parameters. Very restrictive kind of models used in only highly needed situations, but that will now be eliminated. So they were put in place, these restrictions were put in place so that model didn't go without being checked. And so it's been around now a little while, and now we're confident in removing that at the state level. So let me see here. I didn't want to take up too much more of the time here, but those are big pieces. The workforce stability, there's a lot going on in here. This is to, I had mentioned the money that's there in place to the regional centers and the tuition reimbursement, but big money is really in the area of training for the direct support professionals and certification in that area of direct support professionals. And then there's some directed funds in that area. So there's also different rates of pay for bilingual staff who are working with people with developmental disabilities, the direct support professionals. The biggest things, this I will put on the bottom here, the provider rate increases. That began already, and what happened in this year, which was very helpful for the system, or the community system, is that it got accelerated. So it was over a 5-year period of time, and now that will be accelerated so that they can get their rate increases in increments a little bit faster than before. I think it ends up to be about a year ahead of the original schedule. So very important for our system to get the funds to the community providers as quickly as we possibly can. And so that was a major commitment there. There's also some performance incentives for the regional centers and for the providers. And so state is still working on what those would be. And they have to do with providing services and getting outcomes for the increased payments to the providers and the increased commitment and funds to the regional centers. So they're going to put more money in the system. They want to see some outcomes. And so there'll be some performance measures that all of us will look to and show how we met them. So those are all part of the budget as well. And I think I'll move on. And then home and community-based services spending plan, $1.6 billion total funds. Now, the reason to pull this out separate is that these are funds and some funds that came from the federal government and part of the American Rescue Plan Act of 2021. And so you may wonder why would we bring that into this conversation, but it is over a period of time. And these are going to be one-time funding initiatives. So language access and cultural competency, $45.8 million. That's for regional centers to engage in a variety of different initiatives to help the community access the information, understand what's happening in the regional center system, understand the services and how the regional center systems work, and for people who weren't traditionally able to access the services. So in different languages, so the languages where somebody can understand. And then, and that could be a variety of things that regional centers do to communicate to the community, but to communicate to the community in the languages that's the natural language of the family, as well as the individual. So there's a lot of funds in this area. Again, it's called language access and cultural competency, and very exciting initiatives happening. And that's, again, part of that federal American Rescue Plan. And then the coordinated family support services, had mentioned that already, looking at extending supports to families that are supporting somebody in their home throughout their lifetime. It also has they're looking at a way that those families who are traditionally not accepting of some of the regular residential types of services that are available, and they want to maybe for cultural reasons, they would rather the person stay at home. So what could you do in that area as well? So there'd be some adjustments to that need as well using these funds. And then enhanced community integration for children and adolescents, 12.5 million, social recreation and camp services, rate implementation as mentioned, and then information technology modernization. That is just the regional center for the billing system that is pretty antiquated, and they're looking at bringing it up to date. So I'm not really going to cover all of these items here, but because I have already. But the reason to set this slide up is that there are a lot of initiatives that are in place from last year. So the 2021-2022 budget also had a variety of ideas, things that needed to be done to address the needs, and there were funds available. So we had a really good year there as well, but they didn't get all put in place yet. So I wanted to bring them up just kind of real quickly. EVV, the electronic visit verification, passed then, and it's still in the process of being fully implemented throughout the community, just as a process for a person, a direct support professional who goes out to the community, support somebody in their home. And it's just a verification that they started when they said they started, and they ended when they ended. This sort of a clock-in system. It's an electronic system. And that one has been required for many years now, about 6 years. And this is the implementation phase and almost done. The emergency response preparedness resources, you did get additional funds there for go packs and resources that people might need so that they could be safe in times of emergency. And also that we would have coordinated emergency response systems in the regional centers. So those funds are still there, and that initiative is still operating and trying to get that fully in place, and that's still happening. Employment grants, there was increases in employment grants, so $10 million in funding and increase the pathways to employment through grant opportunities. And entities can develop and implement innovative and replicable strategies and practices to increase paid work. And so there were additional funds in there as well. So that was big and still happening. So enhanced integration for children and adolescents. I mentioned that earlier, enhanced services coordination. This is for families who are receiving no services at all or very little services at all and are monolingual or bilingual families, and so are having trouble accessing and understanding how to access the services. So they have these smaller caseloads, and we have a small team in the regional centers that are doing that. So that piece was mentioned again in this budget to ensure that it carries over. And in our regional center, we're got a fully staffed up team, and they're doing great work. So their ratios are very small. So we're looking at 1 to 25, 1 to caseloads, 1 to 40 caseloads. So anyway, very, very small caseloads, and it gives them a chance to give some really close attention to the needs of those families. The foster youth trauma informed services continues on. Regional centers and county officials have been working closely together to create MOUs and coordinate their approaches together for supporting foster youth. And regional centers are in the statute for these activities to make sure that we work with each of our counties to improve the community approach to supporting foster youth, in particular foster youth with developmental disabilities. And then implicit bias training for regional centers. We're working with University of Pacific here, but in the budget, there's a requirement, and there are funds for regional centers to ensure that they're working on addressing and training in the area of implicit bias, and working with their communities to understand what would be needed to bridge some barriers or fix some barriers that exist between regional centers and their communities. And what part does implicit bias play in that role, and in various communities throughout their regions. The language access and cultural competency already mentioned prior. And then the provider rate increases that were going on, and the escalation of that increase. So that odd to mention it now, but it was mentioned, it was done last year, and it's still taking some time to occur. And so it's still listed in the budget. And then self-determination and participant directed services. There were funds in there for regional centers to complete and make sure that we had full teams, at least of 3 participant choice specialists. And we at the regional center here, we have 6, but that program now is fully operational. And then the last in here that from before that has still been, we're still working through, is the provisional eligibility. That seems to be doing very well right now. And we're well on our way to having a better sense of how to do provisional eligibility and bringing in people who, some children, when we determine their eligibility, we're not sure. And it gives us a little more chance to have them a little bit longer and then to assess their needs in a couple of years after their 3rd birthday. So those are the 21-22 initiatives. They're still mentioned in the budget and they're carrying through. There are several things that are going on. And in this one, I still carry them through. Is just created a new sort of graph where you can see how there are so many different things that are spinning through our system that we're working on implementing, and the carryover from last year. The other reason for a lot of the carryover is the federal government has funded a lot of these different programs in a way that doesn't hold us to the traditional calendar of the budget years. And then I want to end on the early start side, because there were a lot of things happening in the early start side. First of all, in early start budget's now 45 million, which is about 3 million less or more than last year. And the changes are due in the budget, really the federal money that's been coming through. And then, and yet there's 5,722 less children. So this is because we're expecting the outreach that we're doing. So the investment made here to reach out to the families and the children in the community is expecting to bring in quite a bit more children. We know that there are more children with disabilities. During the pandemic, we weren't able to access them, and they weren't able to access regional centers. So a lot will happen in this year. That's why so much more funds have come in. So the next slide shows sort of the growth and what happened. You'll see here the COVID impacted estimate population. Here the actuals. So that dotted line there with the COVID impacted estimated population, what they thought it would have been, but what happened in reality is we have this dip. So that dip there with that red line is what happened in our system. But you can see now, as the graph shows, we're increasing each of these months. So we are making a rebound there as promised. And then the next slide, just a few overview pieces here. So reduced caseload ratios for children aged through 5, as mentioned before. Lanterman Act provisional eligibility for 3 and 4-year-olds. The tribal engagement for early start services, so more money to go do some specific outreach in our tribal communities. Early start Part C to B transition, so helping, and that was the IDA piece as well. This is some new changes to. We have an education specialist here, and there are new requirements to help transition from Part C to Part B, and so there's funding in here for that. The early start eligibility, as mentioned before, is another piece of this initiative. Annual family program fee and the family cost petition fee were all suspended for the rest of this budget year. So that means through June 30, 2023, we won't have the annual family program fee or the family cost participation program. And then during the middle of the year, there'll be a plan the governor will make on what to do long-term. And then the transition to C to B specialist piece on top of the new work of the IDEA specialists, and that will impact this group as well. And then Early Start Part C grant funds and Early Start Family Resources, additional funds in these areas. So a big investment in all these areas in the Early Start program. And so watch for that as changes develop. So I'm finally in the Early Start program. This Family Wellness is a grant program. There are 2 regional centers that are selected to pilot this idea of family wellness. I'm happy to report that our regional center is one of the 2 regional centers who will be implementing this program, and it's a very exciting program where when a family learns that their child is eligible for services, then we'll work with them very closely right away. Sometimes it's an emotional process for the family, and sometimes there's a lot of additional supports, maybe counseling supports, therapists supports that the family needs. So not just the individual, the little child, and but also the mother may need some additional support, the father and the siblings and the whole family as a unit. So very exciting new program that we'll be putting forward in this budget year. And then develop culturally and linguistically sensitive services in the Early Start program, additional outreach, some technology, technical assistance and monitoring, and then initiatives in collaboration with the California Department of Education, where the Department of Developmental Services and the California Department of Education will be collaborating with one another and working on ways to sort of mimic what's going on with the IDEA specialists and do it on the state level and help children with developmental disabilities in their education. So that's a whole lot of money and a lot of different exciting programs, and looking forward to another busy year. And next, to close us out, is our chairwoman, Linda Mendoza.
Thank you, Karen, Doug, and Tony, for presenting today. That concludes our presentation of the annual budget report. This presentation will be available on VMRC's website under Legislative Committee. Thank you.